Good morning everyone. Myself Sanjita Pandit. Welcome back to channel Medical with Sanju. From today I start MCQ on maternal health. So the first video on female reproductive system. First about vagina. Question number 1. Vaginal canal normally has option A an acid environment, option B an alkaline environment, option C a neutral environment, and option D an environment difficult to determine. The correct option is option A. भेजाइनल फ्लुइडको pH हुन्छ 3.5 to 4 सम्म, जसमा चाहिँ ल्याक्टोब्यासिलस एडिनोफिल्स प्रेजेन्ट हुन्छ। यसलाई डोडरल्यान्ड ब्यासिली पनि भन्छ। यसले के गर्छ त ग्लाइकोजनलाई ल्याक्टिक एसिडमा कन्भर्ट गर्छ। नेक्स्ट क्वेशन, in a healthy woman the only organs found in upper 2/3 of the vagina is option A monaliasis, option B doderland bacillus, option C gonorrhea, option D thromboniasis. Correct option B. Question number 3. Acid medium of vaginal maintained by option A Trichomonas vaginalis, option B Streptococcus, option C Doderland bacilli, option D E. coli. Right answer is option C Doderland bacilli. Question number 4. pH of vagina during pregnancy. Option A acidic, option B basic, option C neutral, and option D sometimes acidic and sometimes basic. क्वेशन नम्बर 1 मा भनेको थिए कि भेजाइनल फ्लुइडको pH 3.5 to 4 सम्म हुन्छ। दैट मीन्स इट इज एसिडिक इन नेचर। यदि बेसिक नेचरको भयो भने चाहिँ कतिखेर बेसिक नेचरको हुन्छ इन द केस अफ इन्फेक्सन। सो द ऑप्शन A is the right answer. Question number 5. The opening of the Bartholin ducts are situated in the option A vagina, option B uterus, option C superficial perineal pouch, and option D vestibule. Bartholin's gland are two small compound mucous gland located one in each lateral wall of the vestibule of the vagina, that is near the vaginal opening at the base of the labia majora. Option D is right answer. Question number 6. Bartholin's gland is present in option A vagina, option B uterus, option C ovaries, and option D cervix. Bartholin duct is present near the vaginal opening at the base of the labia majora. That means it present in vagina. Option A is right answer. Question number 7. Nurse is about to catheterize bladder of a pregnant lady. She should be aware that all of the following facts about female urethra are true except option A it is about 1.5 inch in length, option B it is posterior to vaginal orifice, option C it is pierces through uterogenital diaphragm, option D it is straight and offers minor resistance for catheterization. Option A मा दिएको छ 1.5 inch in length. It is correct 4 centimeter, that means 1.5 inch को चाहिँ हुन्छ। नेक्स्ट अप्सन बी मा भनेको छ पोस्टेरियर हुन्छ, तर पोस्टेरियर हुँदैन, यो एन्टेरियर हुन्छ हैन। सो अप्सन बी इज राइट। क्वेशन नंबर 8. The pyramidal shaped tissue where the pelvic floor and perineal muscles and fascia meet in between the vagina and anal canal is called as option A obstetrical perineum, option B anatomical perineum, option C perineal body, and option D A and B. Obstetrical perineum. Option A is right answer. Option A चाहिँ हुन्छ right इसको। Next about uterus. The first is which of the following is a normal position of uterus? Option A, retroverted and reflected. Option B, retroverted and retroflexed. Option C, retroverted and antiflexed. Option D, antiverted and antiflexed. The position of the uterus within the true pelvis is of a antiversion. That means lean forward without bending, and antiflexion. That means abnormal forward bending. So the right answer is option D, antiverted and antiflexed. Question number 10. The forward bending of uterus in relation to the vagina is called antiflexion, plantar flexion, antiversion, and dorsiflexion. Just भनेको छु abnormal forward bending means antiflexion. Option A is right answer. Antiflexion र antiverted चाहिँ normal position हुन्छ uterus को. Question number 11. Sorry, typing mistake भएको छ. 11 मा हुन्छ uterus with depression at the fundus is called. Option A, arcuate uterus. Option B, bicornuate. Option C, separate uterus, and option D, uterus didelphys. Arcuate uterus means a bowled or axe-shaped uterus, which is one of the most common congenital uterine anomalies that does not affect fertility. Option A. Question number 12. The thickest layer of uterus is option A, endometrium, option B, myometrium, option C, perimetrium, and option D, peritoneum. The wall of the uterus consists of three layers. The first outer layer is a perimetrium, middle layer is myometrium, and inner layer is a endometrium. इनर लेयरमा चाहिँ कलुमनार एपिथेलियन टिस्यु प्रेजेन्ट हुन्छ, म्युकस लाइनिङ भयो र जहिले पनि के हुन्छ त थिकेस्ट पार्ट भनेको मिडल पार्ट आउँछ. सो यसमा क्वेशनमा सोधेको छ थिकेस्ट लेयर, दैट मिन्स बिचको कुन भयो मिडियम पार्ट, मायोमेट्रियम. सो यसको राइट आन्सर हुन्छ मायोमेट्रियम. Question number 13. Which of the following is the mucous lining of the uterine cavity? Endometrium, perimetrium, and myometrium. यहाँ भनेको छ कि म्युकस लाइनिङ मिन्स कलुमनार एपिथेलियम जसमा प्रेजेन्ट हुन्छ, इनर पार्टलाई भन्छ. इनरमा कुन हुन्छ त endometrium. Option B. Question number 14. Uterine pacemaker situated at option A, cornea of uterus, option B, isthmus, option C, cervix, and option D, body of the uterus. Uterine pacemaker situated at cornea of uterus. Option A is a right answer. One or more, that means mainly two huncha area in the uterus that stimulate contractions of the myometrium during the labor process, known as a uterine pacemaker. Question number 15. What is the normal size of uterus? Option A, 7.5 into 1.5 into 1 centimeter. Option B, 9 into 2 into 2 centimeter. Option C, 7.5 into 2.5 into 1.5 centimeter. And option D, 7.5 into 5 into 2.5 centimeter. Normal size of the uterus is 7.5 into 5 into 2.5 centimeter. Option D is right answer. Question number 16. The normal uterus weight in grams. Option A, 80. Option B, 90. Option C, 60. And option D, 50. Option C is right answer. 60 ग्राम हुन्छ एउटा युटरसको वेट. बट प्रेग्नेन्सीमा 900 देखि लिएर 1000 सम्म चाहिँ यसको वेट बढ्छ. Question number 17. Endometrium in a pregnancy is also known as option A, Decidua, option B, Decubitus, option C, Trophoblast, and option D, gravid endometritis. Option D, gravid endometrium. The intrometrium or the inner lining of the uterus during the pregnancy called decidua. Option A is right answer. Decidua is a name given to metrium during pregnancy. Only pregnancy को बेलामा endometrium लाई decidua भन्छ. Otherwise यसलाई endometrium ले भन्छ जुन के होता inner lining of the uterus. Question number 18. After the fertilized ovum has implanted itself, the endometrium is known as. Option A perimetrium, decidua, myometrium, all of the above. Implantation, fertilization पछि के हुन्छ त implantation हुन्छ हैन. So implantation जुन हुन्छ त्योलाई चाहिँ त्यतिखेर चाहिँ endometrium लाई के भन्छ? Sure, pregnancy को बेलामा हुन्छ यो सबै प्रोसेस लाई के भन्छ त decidua. Question number 19. The cardinal function of decidua is. Option A immunity, option B production of hormones, option C all of these, and option D maintenance of pregnancy. The cardinal function of decidua is maintenance of pregnancy. Option D is right answer. Question number 20. Corpus cervix ratio up to 10 years of age. Option A 3:2, 2:1, 1:2, and 3:1. Corpus के लागि भन्छ त body of uterus cervix ratio up to 10 years of age is 2:1. Be 5 cm body and 2.5 cm cervix हुन्छ कतिखेर 10 years मा. So त्यसको right answer के हुन्छ त option B 2:1. 5 cm body and 2.5 cm cervix. Remaining question in video second. Thank you so much.